Hi, and welcome to the Health for Life podcast for those who want to build strong trucks and strong bodies. This is Kevin Muniz and Maya Hickman, your wellness team, bringing you practical tips and tricks to improve your health. Now, May is Mental Health and Women's Health Month. So today we'll be discussing how to take care of yourself to deal with mental health challenges, and we will briefly discuss some of the women's health issues.
Hello, everyone. Mental health is an important aspect of our overall well-being. We can't argue with that. It affects how we think, how we feel, and act. It is really important to remember that mental health challenges can affect anyone at any time. So seeking help from mental health professional can be an important step in managing your symptoms and improving your overall well-being.
So there are many different types of mental illness that people can experience, and according to the CDC, some of the most common mental health disorders include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors.
Yeah, so when we experience mental health challenges, it can be difficult to know where to turn for help. One way to take care of your mental health is through self-care. Self-care refers to the activities and practices that we can engage in to promote our physical, emotional, and mental well-being. Some examples of self-care activities include getting enough sleep, eating a healthy diet, exercising regularly, spending time with loved ones, practicing mindfulness or meditation, and engaging in hobbies or activities that bring us joy.
Yeah, and it's so very important to remember that self-care is not selfish. Taking care of ourselves allows us to better care for others and be more productive in our daily lives. So if you're struggling with mental health challenges, it's important to seek help from mental health professionals. They can provide you with the support and resources you need to manage your symptoms and improve your overall well-being.
Yeah, there are many different treatments available for mental health challenges. According to Mental Health America, psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional, so a therapist, a shrink, right? Psychotherapy explores thoughts, feelings, and behaviors and seeks to improve an individual's well-being. Now, psychotherapy paired with medication is typically or most often the most effective way to promote recovery, depending on what is going on, of course.
Yeah, some of the most used classes of prescription psychiatric medications include antidepressants and anti-anxiety medications. But some other treatments can include complementary and alternative therapies like yoga, meditation, aromatherapy, sometimes hypnotherapy, herbal remedies, and acupuncture.
Yeah, so a lot of options to explore. It is most important to remember that everyone's experience with mental health challenge is unique. Seeking help from a mental health professional can be an important step in finding the right treatment for you. There are many ways to find a mental health professional near you. One way is to ask your primary care physician for a referral. You can come here to the Volvo Family Clinic and talk to Dr. Hanks or nurse practitioner. They're a wonderful resource for that. You can also check with your insurance provider to see if they have a list of mental health professionals in your area that are covered by your plan. There's also EPA here at Volvo, so keep that in mind as well. Another option is to use online directories such as Psychology Today or the National Alliance on Mental Illness and to search for mental health professionals in your area.
Yeah, so now we're going to transition into our second topic, and it's worth mentioning that women are impacted by mental health illnesses at a higher rate than men, with 1 in 5 women experiencing a prevalent mental illness such as anxiety and depression versus only 1 in 8 in men. There are many factors that can contribute to why women are impacted by mental health illnesses more than men. Some of these factors include biological differences, hormonal changes, social pressures, and cultural expectations. Women are more likely to experience trauma such as sexual assault or domestic violence, which can lead to mental health issues.
Yeah, I mean, so, women face many social pressures that can impact their mental health. Some of these pressures include the pressure to be perfect at everything we do, and a lot of that we put on ourselves, that's for sure. The pressure to become a mother, to be the perfect mother, the pressure to present themselves as having a perfect quote unquote life in social media. So we are also often expected to live for others, right? Well, once we do have kids, they become the focus of our lives, our husbands, our families. There's very little time for self-care, which can lead to stress, anxiety, and depression. Now, all of these issues become way worse as women reach their mid-40s and early 50s. And the reason why is that this is when we start having some of those hormonal changes. And on top of all of that, we have our children to take care of. We're often primary caregivers for our aging parents. So it's a lot to deal with at this age.
Yeah, so we as men need to educate on what our partners are going through so that we can support them in this life stage, which can be very challenging and is life changing for sure. According to the World Health Organization, the perimenopausal and postmenopausal symptoms can be disruptive to personal and professional lives, and changes associated with menopause will affect women's health as she ages.
Exactly. It is so important for women to not feel alone and disregarded as quote unquote crazy. Hormonal changes are real and they lead to many uncomfortable symptoms. Some of those are mood swings, sleeping issues, irritability, increased risk of depression. We may also be forgetful, we gain weight very commonly, and it just tends to kind of stay there, right? We have achy joints, we have decreased libido, to just name a few more, and there's many, many more. In other words, we don't feel like ourselves anymore. So it is so important to remember that we are not alone. All women go through this stage in life and often suffer in silence. So there are many options for treatment, and we encourage you to please talk to your doctor to explore those.
Yeah, so hormone replacement therapy is becoming more of a standard. It does pose certain risk for some women, but benefits will often outweigh the risk by far for many women. Other options include symptom management, like you may be prescribed medication for anxiety or sleep if those are your primary concerns. But in any case, don't forget that what you're going through is normal and that you are not alone and that relief is not only possible, but it is also likely.
I would also like to add, as a woman of that age, that talking to your friends, your mom, other females in your family is so important. It normalizes this issue. They have all gone through this or currently going through it. We need to create a female tribe of support, advocate for ourselves. We're often disregarded and not taken seriously by the medical establishment, but there is a power in numbers. The more of us speak up, the more we will be heard. Women are majority of the population. Women in their 40s and 50s are wise, strong, and capable, and we deserve to be taken seriously and treated with dignity and respect. I've personally been advocating for myself and my patients for a while. So please feel free to stop by if you are curious about exploring the next steps in your care. I'm here to listen to you and support you and can help provide resources and guidance.
Yeah, so please keep in mind that you do have a great support system here at NRV. In addition to wellness coaching and athletic training provided by Maya and myself, you have a team of doctors and nurses that are here to support you and refer you to other health professionals as needed. In addition to that, we have a super fun Move for Your Mental Health challenge going on this week, where we're going to meet on Thursday, the 18th. To move. So we're just going to walk around the walking trail, and you could potentially earn some Amazon gift cards for that. So stay tuned. Keep check on Truck Talk for more information. And thank you for listening today. And as always, feel free to reach out for more healthy tips and tricks at
Maya.Hickman@premiushealth.com.
or at kevin.munez@consultant.volvo.com.
Bye, everyone.
Thanks
Thanks
everybody.
for listening.